want to talk to you about ACL injury prevention. For those of you who might not know, the ACL is a primary ligament in the knee called the anterior cruciate ligament. When you put your foot down, if you're sprinting down the court or a field and you put your foot down, it keeps your lower leg bone from pushing forward and coming out of joint. There's a couple of other ligaments that are in there also, but we're going to primarily focus on the ACL because I know you'll all hear about it on TV. So-and-so injured their ACL. Sometimes it's your most favorite athlete. And you're like, no, not this one. And it changes the game. With the ACL, when you're talking about injuries, you want to avoid what I call the point of no return. The way that we describe the point of no return, I'll describe it in a way describing an athlete, again, running down the court and changing directions or jumping or landing. The point of no return basically is when an athlete lands or they stop their forward momentum and their knee actually turns in, almost looks like it buckles inward toward the middle of their body. Their foot turns out and their torso, this middle part of your body, goes over your knee. It creates a wrenching effect on your knee. And it twists the ACL and it makes it highly probable to tear your ACL. So when I'm talking about this, I want to talk about also the differences in men and women when they land, what we found in research. And this is research that I saw in late 90s and early 2000. What they found, and I'll be able to, if anybody wants notes on this or to know exactly which studies, I can send it to you, email it to you. For right now, just keep it brief. They found that when females land from a jump, they contract their quadriceps, which puts your knee into extension. When males land from jumping, they contract their hamstrings, which puts your knee into flexion, bending. Now, common sense will tell a lot of people that when you land, you don't want to have your knee locked. That's a very uncomfortable position and can promote injury. When your knee is unlocked, it's less of a chance for injury. Also, the straighter your knee is when you land, the less chance you have of injuring it. So we want to keep this very simple. I think that sometimes the best truths are the simplest. So the other thing I want to talk to you about is how we keep this from happening. How we prevent it. Basically, what we do is we, first of all, we use our eyes and ears to watch people jump. I'll go in and watch let's say if I have a person who plays volleyball, basketball, football, the major sports. Sorry if I missed a couple that, there's some other sports out there. And I'll watch and see what their body does when they land. If I see the knee turning in, or if I see them extending their knees, or if I see the torso, if they're out of control, we'll stop them right there and we'll actually use verbal cues to train them with neuromuscular reeducation as to how to land. That goes right away. The other thing I'll do is I'll give them a strengthening program for the muscle that controls the knee turning in. It's called the gluteus medius. The gluteus medius is a muscle that if you watch the best way to describe this, if you watch a martial arts expert and they're kicking their leg out to the side, that muscle that controls kicking your leg out to the side also controls your knee from turning in and putting your ACL in a stress position. So what we do is we have people do a clam exercise. We have them lay down on their side and they have their knees and their hips flexed and they lift the one leg up toward the ceiling and back, and they open it like a clam. The second exercise that we do is a little bit more advanced. It's more what we call the fire hydrant exercise. It resembles what happens when a dog has relieved himself on a fire hydrant. Okay, so it's kind of a crude way to explain it, but most people get that. They've seen that. The other thing we can do is have people do monster walks where they put the bands around their ankles and they walk like Frankenstein. They do circles with their legs and they stay in the squatted position. So those are some of the things that we do. So we'll do a strengthening of the primary muscles that keep the knee from turning in. We'll do a strengthening of the core. Sometimes strengthening of the core will involve things like catching the heavy ball and keeping yourself from moving. Other thing is just teaching them, just like I said, how to land. If you want to have us come out and do a 15-minute consult, or if you want a bigger consult, I can go out to you guys and I can have your entire team. It'll be a free screening to see how everybody is moving or landing. And then we'll take the people who are the athletes who are showing those patterns, and we will correct those patterns and do the strengthening to prevent injury. So go to www.templeergonomics.com and then set up a 15-minute screen. Now, don't wait. You want to avoid them getting injured. You don't want to wait too long.